Need help? Hi, we're Group 3, and we're here to discuss something significant, something you need, the importance of mental health awareness. Do you know that mental illnesses affects 19% of the adult population, 46% of teenagers, and 13% of children each year? Well, here are the 3 possible causes of mental health problems. Number 1, adolescent stage. Parte ito ng puberty stage natin kung saan lumalawak tayo not just physically but also mentally and emotionally. Number 2, inherited or hereditary. O ito ay genetic o namana mo. Makikita sa litrato kung gaano kalaki ang tsansa na pwedeng namana mo ang mental health problem mo. Number 3, life experiences and environment. Maaaring dahil sa past experience mo na masamang nakaapekto sa iyo at sa mga nasa paligid mo, kagaya ng pamilya at kaibigan mo.
Hello guys, I'm Eman Kunggayaw and this is the key facts. At age 14, nag-i-start ang mental health condition at hindi agad ito nalalaman ng tao na nakakaranas ng mental condition, and hindi sila untreated, and suicide is the third leading of death between 15 to 19 years old. Bakit nga ba? Dahil sa age of 15, nakakaranas ka na ng bullying, and pag nakakaranas ka ng bullying, andun yung natotrauma ka and nawawalan ka ng confidence sa sarili mo at hindi ka na nakikisalamuha sa tao. Feeling mo lagi ka na lang mag-isa sa mundo. Lahat ng problema mo, hinaharap mo. Hirap ka mag-share sa mga taong gusto mong pag-share ng problema, pagsabihan. Kaya ito ang nagkukos ng suicide. Mental health condition account for 16 of global burden of disease in injury of people at age 10 between 19 years old. Ayun na nga, nakakalungkot kasi at age of 10 to 19 years old, may nagsusuicide na. Ando na yung nawawalan kasi sila ng, sabi ko nga kanina, yung confidence sa sarili kasi andun yung nabubully sila and trauma. Trauma sila gaya ng sa mga babae na lang, yung nababastos sila sa kalsada, nakaka-catcalling, etc. And andun yung nag-overthink sila na baka ma-rape sila sa labas, and nawawalan sila ng confidence sa panunood, sa pananamit nila, ganyan. And nahihirapan silang sabihin o mag-voice out para paglaban yung nila, karapatan and something ganyan. And the consequence of not addressing adolescent mental health condition, at ito naman yung hindi mo na i-enjoy tuloy yung buhay mo, and hindi ka confident sa araw-araw mong pamumuhay, and nililimit nito yung mga opportunities na dapat mag-lead sa'yo papunta doon sa successful, para ma-enjoy, ma-explore yung buhay na kung anong dapat na kailangan mo i-explore. And next slide. What exactly is a mental illness? Papaliwanag ni Andy yan. Thank you.
A mental illness is a physical illness of the brain that causes disturbance in thinking, behavior, energy, or emotion. Ayun, yung mental illness ay nakakapekto sa utak, pati sa pag-iisip natin, sa ugali, sa lakas, emotion. Yan. Research is starting to uncover the complicated causes of these diseases, which can include genetic, brain chemistry, brain structure, experiencing trauma, and or having another medical condition like heart disease. So ayun, yung mental illness din pala nakaka-apekto sa loob ng ating mga pangangatawan, like sa puso, sa utak.
The two most common mental health conditions are
anxiety disorders depending on the methods of case ascertainment used. Anxiety disorders affect 5%-15% of children and adolescents. This includes post-traumatic stress disorder, obsessive-compulsive disorder, panic disorder, and generalized anxiety disorder and specific phobias. Occasional anxiety is an expected part of our life. You might feel anxious when faced with a problem at work, but anxiety disorders involve more than temporary worry or fear. The fear and anxiety can cause significant problems in areas of their life, such as social interactions, school, and work. Anxiety disorders are among the most common mental health conditions. They affect people of all ages, adults, children, and teens. Anxiety occurs too often, is too strong, is out of proportion to the present situations, and affects a person's daily life and happiness. For some, the physical sensations can be strong and upsetting. People with anxiety disorders might avoid talking about their worries, thinking that others might not understand. They may fear being unfairly judged or considered weak or scared. Although anxiety disorders are common, people who have them may feel misunderstood or alone. Mood disorders such as depression and bipolar depression, although depression is less common in younger children. By adolescents, it may affect about 10% to 15% of patients. A mood disorder is a mental health problem that primarily affects a person's emotional state. It is a disorder in which a person experiences long periods of extreme happiness, extreme sadness, or both. In our everyday life is like a roller coaster of emotions. You may feel down in the dumps due to the relationship problems, financial troubles, or because you got a flat tire of the way to work. Mood disorders are characterized by a serious change in mood that cause disruption to life activities. Mood disorders are diagnosed through both physical examination and mental health evaluations. Mood disorders are treated primarily through medications and psychotherapy. Typically, antidepressants and anti-anxiety medications are prescribed.
Anxiety and mood disorders are among the more common emotional disorders in youth. Depending on the methods of case ascertainment used, anxiety disorders affect 5% to 15% of children and adolescents. Although depression is less common in younger children, by adolescents it may affect about 10% to 15% of patients. Anxiety and mood disorders affect boys and girls more or less equally, but adolescent girls are much more vulnerable to depression than boys. Suicidal ideation is not uncommon in adolescents, affecting as much as 50% of youth. However, actual suicide attempts are less common and occur disproportionately more frequently in female adolescents than in male adolescents. Males, however, are more likely to complete suicide. Children and adolescents with anxiety or mood disorders are vulnerable, as well as increased cardiac and other somatic problems in adulthood. What can you do to help?
Showing individuals respect and importance. First thing that we can do to help is by showing them respect and help them feel that they're important. If you know to yourself na you're mentally healthy, then respect those who are suffering from the illness. Also, make them feel that they're important by not treating them less. Treat them on how you treat other people. For people with mental health issues, the social stigma they experience can make their problems worse, making it harder to recover. So aside from medication like psychotherapy, we can also help them by showing them respect and importance. Advocating within our circles of influence. Advocacy is an important means of raising awareness on mental health issues. So how can we do that? By the next slide. Learning more about mental health. Because simply, we're getting tired of common misconceptions about mental health, right? Like they said that having a mental illness means you're crazy, when in fact, you are not. Having knowledge about mental health is important. It helps people better understand their own mental health. Another thing is that you'll know how to treat people who are suffering from mental illness. So, gaya kanina, you can have your own advocacy by sharing your thoughts and knowledge doon sa mga masyadong hindi pa aware sa ganitong problema. And lastly, kung ikaw ay nalulungkot, iritable o mainitin ang ulo, magulo ang takbo ng isip, gusto mapag-isa, o nag-iisip na saktan ang sarili o magpakamatay, you can call our NCMH crisis hotline, sir 917-899-8727. It's a 24/7 mental health crisis phone service established by Department of Health through National Center for Mental Health. Kung feeling mo walang gusto makinig sa'yo, wala kang makausap, someone right there always got your back. Always remember that it's okay to feel unstable, it's okay to feel disassociate, it's okay to hide from the world, it's okay not to feel okay. Your mental illness is not a personal failure. Your mental health is a priority, your happiness is essential, your self-care is a necessity. Mental health is important, just as important as physical health. That's it. Thank you for those who gave their time listening on our presentation. Also, special thanks to Ms. King for letting us share our thoughts and knowledge about the given topic. Always remember that mental health matters and you matter. Thank you.